Phil, thanks for joining me here on Deeper Dive. Tell me, what were USAID and the State Department's humanitarian programs doing in Thailand and the region?
Well, there's a whole bunch of different programs that were being supported by various different parts of the U.S. government. There was the USAID programs. Then there was programs that were being supported on democracy and governance by the Democracy, Human Rights, and Labor Bureau of the State Department. Other programs being supported by the Population, Refugees, and Migration Bureau of the State Department. Perhaps most prominent is the work that was being done on the Thai-Myanmar border, particularly with the refugee camps. As soon as the USAID cuts were made, groups like the International Rescue Committee had shut down their hospitals that were servicing refugees. There were a number of cases of elderly refugees who all of a sudden couldn't get the medical care they required and died. And on the other side of Myanmar, in Bangladesh, in the refugee camps that are housing the Rohingya, who fled ethnic cleansing and crimes against humanity inflicted on them in 2017 by the military junta. Those aid programs largely stopped that were provided by USAID. But more importantly, after the military coup in 2021 in Myanmar, there was a reprogramming of the USAID money that had been provided to the government. Of course, they stopped providing that as support, and they worked to find other partners. And some of the partners they found were groups and organizations that were working in areas that were controlled by the ethnic groups that were in areas now that are now contested. And in some of those areas, for instance, as ethnic organizations were building up their administrations, they're receiving support for health and education assistance. There was a big Myanmar education consortium that was providing education to children all over Eastern Myanmar. And that has all been shut down. And we've also seen, for instance, the democracy and governance programs that were, for instance, being run by Freedom House, that was providing safe houses for people fleeing the military regime in Myanmar. As they were trying to get to safety, there was a network of safe houses that were being supported by the U.S. government, and those have all been shut down. So it's been a complete and total disaster. Even before we got to the earthquake last week, which has now created a massive humanitarian imperative that the U.S. is failing to meet. I mean, they've gone from leaders to laggards in disaster assistance around the world, and nowhere is that more clear in the situation in Myanmar.
Yeah. Now, the Bangkok Post reported that on February 2nd, a 71-year-old Karen refugee died after the US-funded healthcare facility she depended on was ordered closed. But presumably that's just one of thousands of deaths that have occurred.
You're absolutely right. And I mean, healthcare is a huge issue in Myanmar. So, for instance, there was a big U.S. Supported malarial initiative.
Right. And there's also been tuberculosis programs all over the world, HIV
To
prevention
try to wipe out
programs.
malaria, resistant malaria. Exactly. Exactly. So when you talk about a humanitarian crisis, certainly the pullout of U.S. resources, which was one of the largest set of resources being given to health and education, you can't replace it. There's an effort, I think, by some other donors to try to step up, but they're just not going to be able to meet the scale and breadth of what the U.S. was funding.